Mr. Chairman, members of the board, Dr. Casey. I want to take a few minutes this evening to provide you with a brief update on the ongoing efforts to vaccinate the county's workforce, and then we'll pivot over to a new tool that is now available to our residents to better track the progress in vaccinating the broader community. Next slide, please. Through the collaborative efforts of Chesterfield Fire and EMS, our school division, and the Employee Medical Center, a total of 8,242 1A and 1B county and schools employees have received their first vaccination, and 7,663 are now considered fully vaccinated. With this heavy lift behind us and a significant decrease in COVID-positive cases among the workforce, we're now at a point where the Employee Medical Center can take over responsibility for all future vaccines for county employees and new school employees. This will allow the Fire and EMS pod operating at the Public Safety Training Center here on the county government complex to continue providing relief to the health district so that they may be able to focus more directly on the 1B population and the community at large. To that end, firefighter paramedics have been vaccinating numerous employer-based groups, including the Virginia State Police and Department of Emergency Management, our private schools and daycares in the county, and this week we'll accomplish over 1,000 vaccinations to manufacturing, food, and agricultural staff at our pod here at the County Government Center. In addition, members of our Mobile Integrated Healthcare Program, our MIH team, are focusing on vaccinating bed-bound residents in the community that are in need of these vaccinations. Altogether, county and school resources have administered over 18,500 vaccines as of the end of this week. So that's good news. Next slide. There continues to be a significant focus of county resources in support of our health district partners. 7 of our county departments remain actively involved in the countywide vaccination effort. Some departments have employees that are totally redeployed to this effort, while others have multiple individuals who spend each day thinking about and working on the vaccination process. Now, you heard from Dr. Worsley as well as Dr. Samuel some of the examples of how our employees are really making a difference in the efforts to vaccinate our citizens. But let me highlight an issue that happened over the weekend just to give you a sense of the level of that commitment. We've talked about the state lists, the wait lists, and some of the frustrations that are surrounding those lists. And just to tell you a little bit about what our IST department and members of our emergency management staff had to work through in concert with the health district staff over the weekend just to schedule 1,000 appointments, 1,000 appointments for our Monday pod at the fairgrounds. It was necessary to perform outreach to 12,694 of those Chesterfield Health District residents on the state's wait list just to get enough residents scheduled for Monday's pods. So the IST department pushed out a lot of emails in that process, and approximately 50% of the emails that they pushed out did not receive a response from a resident that was registered. Around 37% of those contacted either by email, and thousands of calls were made by staff over the weekend to touch base with individuals that had cell phone numbers or home phone numbers. Around 37% of those opted out of the vaccine, mostly because they had already been vaccinated, yet they still showed up on the state list. So there are a lot of issues that still have to be resolved there. But again, thanks to the efforts of staff, around 1,600 were confirmed as available for either Monday's pod or the other 2 pods that have been held this week. And IST and Barry Condry and his staff have really done a stellar job not only building the platform that they have for registration and scheduling, but they've been on site each and every pod. They're working with the health district on an interim process, if you will, until such time that the state can provide an improved platform through which people can register and schedule. So again, it's a very well oiled machine. If you have the opportunity to go and visit one of the pods, I would encourage you to do that. It has a new layout, and certainly we have staff on site that would be happy to give you a tour, so please take that opportunity. Next slide. An important effort in which we are engaged in assisting the health district is with data analysis for improved decision making. When I last appeared before you, I highlighted a new dashboard under development that really aggregates the vaccines that are administered by various partners operating within our community and kind of benchmarks the progress in vaccination efforts in Chesterfield County as compared to other metro-sized localities in the Commonwealth. I'm happy to announce that this new dashboard is available for our residents to view and explore on the county's website. And Captain Brian Warshowski, who was the brainchild of this dashboard, is here with us this evening. And Brian worked with Natalie Spillman to refine the dashboard, and Trip Ray and Art John and IST to get the dashboard posted on the website. So I'll ask Brian to give you a brief update and sort of walk you through some of the features that our residents now have available to them with this dashboard. Brian?
Thank you, Chief. So the dashboard is comprised of 4 primary pages. As has been announced previously, we have established a community vaccination goal that consists of 75% of our vaccine-eligible residents. That equals 190,596 residents that we're aiming to get vaccinated. The chart that you see here at the top, the bar chart, is illustrating the percentage of that goal where we're at. This is taking Weldon-Cooper population estimates from those demographic areas and applying them to localities of similar size to us, so localities within the Commonwealth that have more than 200,000 people. As you roll over each one of them, all of them are interactive and linked together. And you can see that Chesterfield is currently appearing by that methodology second on that list. One of the things that you also see in the table down below is the number of people who have received at least 1 dose, the number of people who are fully vaccinated, and then a daily average based on a 30-day sample of how many people we're vaccinating on a given day. That number is then taken and extrapolated out to what we're calling an estimated goal date. I will caution you that this goal date will change on a daily basis as VDH updates their data. And all it is doing is illustrating that 30-day average. The second page on here is a breakdown of vaccinations within Chesterfield as a locality. So it's important that we stress locality here and not health district. We'll get to that one in a minute. As you look across here, you will see all of the Chesterfield residents that have been vaccinated over the last 30 days, broken down by facility type. You saw an early version of this chart last week when Chief Center presented it. Down on the bottom, you can see the number of residents that have received at least 1 dose, those that are fully vaccinated by a 2-dose method, whether it be Pfizer or Moderna, and those that are fully vaccinated by the new Johnson & Johnson. Again, all of these are tied together, so if you want to see how many people on a given day were fully vaccinated with their 2nd dose, you can click on that and it highlights accordingly. So a good example of that is to click on the Johnson & Johnson one, which we've had 1 pod to push out so far, and you can see that it shows up there with the total number administered, et cetera. The numbers on the side over here, total first dose, this is referring to people who have received at least 1 dose of Pfizer and Moderna or people who have received the Johnson & Johnson. Fully vaccinated is referring to people who have received a 2nd dose of Pfizer or Moderna, as well as people who have received that single dose of Johnson & Johnson. And total doses here can simply be equated to the number of needles that have gone into arms. So whether it's 1st dose, 2nd dose, whatever. We then have the 3rd page here, which is very similar to the last one, but this is now looking at the health district. So now we're including the localities of Powhatan and Colonial Heights in here as well. All of the charts in here remain the same. Again, they're all tied together, so you can see on any given day where vaccines were administered and what the vaccination status of each of the citizens that received them were. The metrics over here are again calculated the same way: 1st dose, fully vaccinated, and total doses. The last page of the dashboard is perhaps the most exciting for us. This is where it allows us to get in and begin to really both examine the strategies that have been put in place, the vaccination strategies that have been put in place for effectiveness, as well as compare ourselves to other localities to see how we're doing. So here you can see we've got Chesterfield County and Henrico pulled up side by side. When you look at the 2 charts, you get that visual representation, and immediately you might be drawn to the larger blue slice over here on the Henrico side. That's the federal vaccines administered through that federal long-term care program that Dr. Samuel alluded to earlier. That's relevant to us because those doses are outside the sphere of the county's influence or control. So if we really want to see on an apples-to-apples comparison how one locality is doing versus another, we can control for that. We can pull it out, and then we can look and see that Chesterfield has administered 48,945 doses to 44,131. Again, when you compare the two pie charts side by side, you'll see that this pink slice over here, representing other community health providers, is substantially larger on the Chesterfield County side. That is both illustrating and reaffirming the collaborative approach that the health district and the county government has taken, because the providers that fall under that category are both the employee medical center and the fire and EMS pods that are administering vaccines. So I'm happy to answer any questions that you have about it.
Questions, comment, board members?
Mr. Chairman, this is outstanding. I mean, this is exactly what the doctor ordered. Sorry, Dr. Samuel. But, you know, a lot of people have asked, hey, how many have been administered? Where can we find this information? And this is just transparency times 10. And I think our folks are really, really interested. I got a call the other day from a lady who was asking me about, you know, do we have a dashboard product? And I said, I do think it's coming, and so here it is, and it's outstanding. It really is. This is outstanding work, and you know, give this man a raise, Chief. So, you know, but when you start to really boil down into what the efforts are in our locality, it looks like we're running on as quickly as we can, all cylinders that we have to run on, and I know that that's under some constraints in the health department, but. Really, really nice work here.
Other comments and questions?
Just wanted to say, I don't think you mentioned it, but I went to the website as you were doing the presentation. And as you show there, Henrico's showing, but there's a drop down to the right of Henrico.
Yes, sir.
You could pick any locality in the state and look at where we compare to any other locality, not just Henrico.
Yes, sir, that is true.
That's a pretty good feature as well that I didn't think you had mentioned.
So yes, you are, that is correct. You are able to pick any locality in there whatsoever.
That's fantastic. That makes it even more dynamic.
Yeah, you do truly need a raise. You're right.
And it's readily available information. It's being pulled from the state's website, and then, of course, we've overlaid the UVA Weldon Cooper population estimates across the board, and so it updates once a day, usually around 12:30. So that gives us the most relevant information.
It did take a little searching to find it, though, so we need to make sure we make it really easy to get to.
Okay.
Yes, sir.
Any other questions from the board? Okay. Well, thank you for your time.
Thank you.